Are you like most people? At times you may have a question for your doctor, but you can't get to him or her, so that you may ask your question. Good news. Your worries are over. Because the Mount Pilgrim Missionary Baptist Church, in partnership with Caldwell UNC Healthcare, bring to you Let's Talk to the Doctor, a 15-minute talk with real doctors from the Caldwell UNC Healthcare, designed to educate and answer questions that are a concern in our community. Let's not forget, our communities perish for the lack of knowledge.
Well, good day, as good evening, and welcome to Mount Pilgrim Straight Talk. We're so blessed again to have as our guest this evening, Dr. Lowery from Caldwell UNC Hospital. I get that mixed up every time. I don't know why, but thank you for that. And as we said, this is Straight Talk, so we're going to get into some straight talk and maybe hit some topics that of course we have been experiencing for this last year and a half and maybe continue on. But we're going to talk about the COVID a little. We're going to talk about the variant a little. We're going to talk about the booster and some of those things. But I would just like to start it off, Doc, with COVID. Where are we at with COVID as far as the medical community is concerned? Hospitals or what? But where are we at as far as the vaccines and the hospital?
Great question. We were in a very, very bad place around Christmas and first of the year, locally, statewide, and around the country. And as you remember, we had Samaritan's Purse Field Hospital in Lenore, and the region was overrun, and beginning early February, the number of cases started to subside as vaccinations came out. And a month ago, we were in a really good spot. There was one day about a month ago when we had absolutely no patients in the hospital with COVID. That just lasted one day. Over the past 3 weeks or so, we've seen a significant uptick in COVID cases here in Lenore and Caldwell County, but also statewide and throughout the nation, especially in certain areas. The difference is that most of the people who are developing COVID are being infected with what's called the Delta variant. It's estimated now that over 80% of the COVID infections in the United States are due to the Delta variant. And the majority of the people with infections now are unvaccinated.
Do you think, Doc, that the resurgence of the COVID and the Delta variant is because of people are reluctant to wear masks?
Now, the Delta variant was first identified really in India, and a couple of months ago in the news, it was very much in the news about a very high incidence of COVID, a spike of COVID cases in India, and a large number of people dying. And unfortunately, that variant has now spread to the United States. I think the major factors involved in the current spike are the fact that the COVID variant is a lot more infectious, and that fewer people have received the vaccine than we had hoped initially.
So the COVID variant is more serious, or it can do, I don't say danger, but...
Well, it's not necessarily that it makes anyone sicker than the original virus, but it's more contagious. If you're exposed to the Delta variant, you're more likely to get the infection than if you were exposed to the plain old COVID virus.
So the blood types, who could be the most vulnerable, or does the blood type make me more vulnerable to either one of these as another blood
That's
type?
a great question, and there's a lot of research going on, and there are probably a lot of factors that that make one more vulnerable or less vulnerable. There's some thought that those with a type O blood have some degree of resistance. And that may be the case, but it's not complete resistance, because there are plenty of people with type O blood who have been infected and who have gotten very sick or died. But there are certainly other factors as well. I mean, there are young, healthy adults who have died from COVID, yet I've read of World War II veterans who are 100 years old who survived the COVID infection. And what would make a otherwise elderly person who would be very susceptible to complications survive, but a young, healthy person not? A lot of unknowns.
I'm sure all of this now is a lot of unknowns, but we have made, I say we, the medical community has made many inroads into combating this virus, and I'm sure there will be, or still a lot more studying that's going on that we need. But I was really thinking about the children, and I don't know where we're at or where the medical field is at now with the vaccination of children, or what type of vaccinations are they going to receive, whether it's the Moderna or the Pfizer or whatever, or has it.
So right now the vaccines, the Pfizer vaccine can be given to adolescents, teenagers, those in age group 12 to 17. Those younger yet have not been approved for vaccination. However, the best protection for a child is to have the adults that they're around be vaccinated. So so for example, if the parents or caregivers of the young child are vaccinated, that child is much less likely to become sick.
You know, and I'm guilty of this. I go to the Quest, and normally when I'm working out on the treadmill or whatever, I very rarely have my mask on. But when someone comes up to talk, then I'll remember to put it on, and sometimes I don't. Am I being contrary, or am I disobeying the law, or could I be passing this even with me working out and not using my mask?
Well,
I won't say contrary, I'm always contrary.
I mean, well, that's a good question, a difficult question. And you know, that's something that's very controversial in terms of whether we should be wearing masks or not wearing masks, or universal mask use or indoor mask use. Wearing a mask is just one means of protection, but ultimately vaccination is the best means, best way to stop this. So strictly speaking, if we were to be completely safe, wearing a mask when you're talking to others is an extra safety measure. But vaccination is the primary way to be safe and to prevent others from getting the disease. So if I had a choice of being close to someone who's not wearing a mask but who's received the vaccine versus somebody who's unvaccinated but wearing a mask, I would pick being around the person who's been vaccinated. And unfortunately, the vaccination rates have fall far short of the goal. The president's goal had been a 70% or more vaccination rate around the country by 4th of July, and we're a little over 50% nationally. And in Caldwell County, actually, our total vaccination rate's less than 40%.
I thought it would be more than that.
No.
I know now with school beginning to gear back up, and there's been a lot of controversy, maybe a controversy as to what district is going to require masks or the shots. How much of an influence does the medical community have with the schools as maybe encouraging them or speaking to them about the mask?
Well, I know we've met, we meaning Caldwell staff have met on regularly throughout the COVID pandemic with representatives from Caldwell County schools as well as the local college, and have had very good constructive conversations along the way. Ultimately, any decision that's made is up to the school board and the administration of the school.
Yeah.
So, but we've always been welcome to give our advice and
Right, yeah.
help and opinions.
Now, I know a lot when you said 40%. I don't know why I would have thought that it would be more than that, 40%, but I've noticed it even in our community, in our churches here in the Black community. A lot of people are reluctant to take it simply because of different news and the CNN, and I'm not blaming any of those, but they sending out false messages, and people are just terrified because they don't know what to think. So I think the main purpose of Straight Talk is to get the information straight out, and as often as we can, and maybe from the pulpit, is to encourage people to do this. I know a lot of people have taken the shot, but with this new variant coming out, is there going to require another shot, or maybe I'll say a booster shot for people?
Yeah, that's a great question also. The vaccine, it seems to be protective against the variants,
Yeah.
including the Delta variant. Now, there are people who have gotten infections after being vaccinated.
Yeah.
We've been seeing that. That's well known. But that's not uncommon. The same thing happens with the flu.
Yeah.
I had personally, I have a flu shot every year, and about 5 years ago, I got a case of the flu after having been vaccinated, and that happens. But a vaccine attenuates the course of the disease.
Okay.
So if you're vaccinated against a disease and you happen to get that infection, the infection is likely to be much less serious,
Yeah.
and of a shorter duration. So what we're finding is that many of the people who get a COVID infection after vaccination have a less severe case of COVID, and so the vaccine may prevent them from dying. They may
Right.
still, but in most cases, the vaccine does seem to be protective against all strains. Now, the question of a booster shot is still not clear. How things work. The scientists who study vaccines will look at a group of individuals who've been vaccinated, and then they follow them, every so often, monthly or weekly, for a long period of time. They measure antibodies in their blood and see if they wane or decrease over a period of time. So I think initially when we started giving the vaccine, the teaching was this is going to last for 3 months. You're going to be good for 3 months.
Yeah.
Well, now the vaccine's been out for 8 months, and they're saying, well, it still seems to be good in most people. So I'm sure at some point we'll get more clear advice that you need a yearly booster, or the vaccine's good for 10 years or 5 years. Not clear indication yet what that will be.
Well, I would say, just from an outsider, a person's immune system would have an effect on that as well. The better your immune system is, and I would think the better care you take of yourself prior to that would serve as well, as you overcoming it quicker, or you surviving it during it. Does that make good medical sense?
It does. Ultimately, a person's immune system is the most important thing. That's why people who, for example, an elderly person who's undergoing chemotherapy for cancer is particularly susceptible to infections. There's also some thought that people who've been vaccinated but have also had a COVID infection have super duper immunity. So in my case, for example, I received the first dose of the Pfizer vaccine, but then about a week later, before I had full immunity, I got COVID. So I had a COVID infection. Then I had to wait 3 months to get the second dose of the vaccine. So now I've been fully vaccinated, but I've also had a COVID infection. So I'm hoping that I have especially good immunity. I don't know that that's the case, but that's the thought.
I guess the thought would come to me, what helps you to build your immune system up to help combat this virus?
Well, the basics for immune system health, assuming that someone doesn't have a disease that affects the immune system,
Yeah.
or a medication, like somebody who's taking prednisone chronically for an inflammatory condition would have a depressed immune system.
Yeah.
But getting enough sleep, eating right, um, exercising, even things that are fairly moderate exercise, like walking, going out for a good walk, laughing. Actually, there's data that shows that people who are laughing and engaging with other people. That's why I think church is so important, because church, uh, I mean, it's important for many reasons, not only, but one of the benefits of people who are involved in church is being in a community where they're loved and cared for and have connections and friends. And that actually boosts the immune system.
Okay.
So people who are lonely and isolated and have weaker immune systems.
Yes. You know, it brought something biblically back to me when you said all the requirements of the things that you must do to build up your immune system.
Mm-hmm.
I thought about the rich young ruler when he asked Jesus, what must I do to be
Mm-hmm.
saved? And when all respect your mom and all, he said, I've done all those things since my youth up. So when you said eat, I do that. Sleep, I do that. Exercise, I do that. Okay, what else am I supposed to be doing, you know?
Yeah, and the one thing I could say, if I would get a vaccine, for
Yeah.
those who are not vaccinated, yeah, there are fears about the vaccine. I can say that the scientific data out there, I think, shows that they're pretty safe, and very safe actually. But are there potential complications? I'm sure that there are, and I'm sure that there are some people who have adverse effects.
Yeah.
But I also would say that over 600,000 Americans have died over the past year. That's more than in World War II, Vietnam, the Korean War put together. And so I would say that somebody is much more likely to get a severe COVID infection or die from COVID from not getting a vaccine than they are to have a complication from the vaccine. That being said, I understand their worries and concerns.
Yeah. But I think, Doc, that we have squashed these, hopefully, concerns now. And I say that because when people look at the folks that have died, or some of the folks that had contracted disease and recovered, they have a message to tell, they have something to say. Mm-hmm. So I'm thinking that I'm hoping that we may be winning this battle against those that fought against taking it. And that was one of the reasons that I wanted to continue the conversation with the hospital. Who else better could give us the information that we need any more than those people that are first online, right? Those doctors, those hospital personnel that know what's going on, that see it firsthand. So as I've shared with your colleagues, that I want to continue these conversations, and I think in the next couple of weeks we'll do a tour from the hospital, and I'm hoping that the more information that we can get out from the people that are online, from the people that see it every day, the more convincing that we can be, and maybe share this with our public. And I'm hoping that you guys, and I've encouraged others to promote Straight Talk, because what we are giving here is necessary information. What we're giving here is a life change. What we're giving here may save a life. We never know. So, Dr. Lowery, I can't thank you enough. I say that all the time, man. I'm just very appreciative of what you share with us, and how you take time out, and your other staff there at the hospital. I know we got a guest, and maybe we may ask him to do something one time, or I should just call on him now, but we won't do that this time. But again, thank you so very much, and I look forward to, guys, I look forward to next week, next Thursday, to do that. I don't know if you're aware of this. Are you? Well, maybe I shouldn't say this right now. It may have been a surprise, but we'll get on to that next time. But again, this will end our session of Straight Talk, and thank you, Dr. Lowery,
Yes, sir.
and the hospital
Pleasure to
for
be
being
here.
in. Just want to leave it. If you have any closing words.
No, it's just thank you for your outreach and your willingness to bring information to people, and I just appreciate that. And I just want people to be aware that COVID is still out there. We're still dealing with this, and please, if you haven't been vaccinated, please consider strongly getting vaccinated.
Thank you, sir. Thank
Yes,
you
sir.
so much. And this will conclude our Straight Talk session for Thursday. Thank you and have a good evening.
What an informative and educational segment. Reverend Perkins and the Mount Pilgrim Media Ministry want to thank you for tuning in. We are located at 539 Willow Street in Lenoir, North Carolina. Please visit. We would love to see you. Join us every Thursday, right here at 7 p.m. with another segment of Let's Talk to the Doctor. Be blessed, and we look forward to seeing you next week. We would like to thank our partners, Caldwell UNC Healthcare, as we are doing good in the neighborhood. Please hit your share button at this time.